We started a discussion on preconception care, and today I bring you another episode on preconception care. And I just asked ChatGPT a simple question. I asked ChatGPT, what are the myths concerning preconception care? What are the thoughts that people have about preconception care which are false medically? And I got very interesting responses I want to talk about today. Probably you may have one of these in your head. The first one Chat said was, you only need to start preparing once you are pregnant. So I think for those who have watched the previous episode on preconception care, this is a myth that I already spoke about. You don't need to start your pregnancy journey only when you realize you are pregnant. If you want to be pregnant, you have to start the journey because, like I said in the other video, there are a lot of things that can be done for you even before you get pregnant. There are a lot of things that can be prevented. So one thing we have to understand is that preconception care is a preventive health care delivery system. So it prevents anything that may have happened if you have not done preconception care. So you don't need to start only when you are pregnant. Start before pregnancy. Someone asked in the comment section that when should they start? Ideally, you should start 3 months before you get pregnant, or as long as you are trying to get pregnant, see your doctor for assessment. The next one Chat said was, if you look healthy, you are fine. I mean, it's normal to think that if you look healthy, you are fine. But let me tell you that there are some medical conditions that are silent and may be hidden. You may not even have an idea until you are assessed. So that is absolutely false. If you look healthy, it doesn't necessarily mean you are fine for a pregnancy. You need some assessment. The next thing that Chat said was, you should stop exercising when trying to conceive. Wow, that's quite interesting. So when you are trying to conceive, you should not stop exercising. The reason is that obesity or excess weight gain has implications in pregnancy. One of the commonest implications of obesity in pregnancy is diabetes. So pregnancy in itself makes you prone to abnormal sugars in your blood. So if you are obese from the start, it worsens your case. So yes, if you want to conceive, it's actually a good step to be exercising so that you can maintain a healthy weight for the pregnancy. The fifth myth, or the next myth, is very interesting. Chad said fertility is only a woman's issue. I mean, I think most of us as of now know that this is false. You know, most of the infertility cases we see, about 40% of them is as a result of male factor infertility. So what that means is that about 40%, about 4 in 10 cases of infertility, the problem is actually from the man. So it's not true that pregnancy is only a female issue. Males are also involved. So the point is that the ideal thing is that for your preconception visit to your doctor, you have to go with your partner, because your partner will also undergo some assessments that will help him, right? So it is not only a female issue. That's very important. The other thing Chat said, only older women need preconception care, and that's absolutely not true. It's not only older women who need preconception care. Very young women also need preconception care. As I've said earlier, there may be hidden conditions, there may be silent conditions that will be unearthed during the preconception assessment. So yes, younger women as well as older women are encouraged to go for preconception care. Now the next thing, probably you fall in this category. Once you've had one baby, you don't need preconception care again. So you know every pregnancy is a different experience. For those who have been pregnant before, you know that the experience of one pregnancy is different from the other. So the fact that you've had a baby doesn't mean everything is okay, so you can just go ahead. It's actually a reason for you to seek another care, because especially if your first or the baby before this one is not so old, your system may be depleted of nutrients, of minerals, ions, and some things. So all these things are important. So because of that, you need preconception care. Very, very important. So these are a few myths. There are others, but I think these are the most important ones I want to address today. The last bit of this session is to give you just a little bit of detail on preconception care. There were some things that, after going through the previous episode, I want to add. One very important thing about preconception care is lifestyle modification. So the lifestyle modifications I've already addressed: exercise and good weight control. That's very important if you are trying to get pregnant. And then the other thing is nutrition. You have to eat well. So when you are pregnant, you are put on some supplementation. Take note that all those medications you take in your pregnancy are supplements. So they are just going to add up to what you are taking. So you have to eat well to replenish your system, so that when you are pregnant, your body is ready and set for the pregnancy. The other thing about lifestyle modification is alcohol intake. So you are advised to stop alcohol intake, because it can cause some issues for your baby's development. Your baby's development may be problematic if you are taking alcohol, if you are abusing alcohol. So for women who are trying to get pregnant, it's very important to avoid alcohol. Even for the men, because alcohol and smoking, for both sex, alcohol and smoking affects the quality of the male's sperm. It affects the quality of your sperm. It can also affect the quality of your egg as a woman. So if you are taking all of these, you may end up having a baby with problems, with developmental issues, with structural problems. So it's very important that you stop alcohol or cigarette smoking or any form of recreational drug that you are on, if you want to achieve a healthy pregnancy and a healthy post-pregnancy experience. Yeah, so I am sure by these you have a fair idea of what preconception care is. The last bit that I want to add, I know it's getting longer, but very important. I don't want to come in another part for this topic. There are some medications I spoke about the last time which you'll be asked to stop. For some women, especially those who have asthma, those who have hypertension, those who have diabetes, sickle cell, all those medical conditions, the important thing is that they are brought under control. So for those people, you even need the preconception care most. You know that sadly there are some women that after undergoing the preconception care, it will be unearthed that you are not strong for a pregnancy. On those situations, we give you time, treat you, and get you ready. If for some reason you are still not ready, there are alternatives of using the assisted reproductive technology, where somebody can carry your pregnancy for you. I'm sure most of you are curious about that. I will share more on that in another episode.